A yellow crust on your dog's teeth can look like ordinary dirt, but what it represents may be far more serious. Tartar is not the beginning of the problem. It is evidence that a living bacterial film has been building on the teeth. That film is called plaque, and it can collect quickly after eating, especially where the tooth meets the gum. When plaque is not removed, minerals in saliva can harden it into the rough deposit we call tartar or dental calculus. The rougher that surface becomes, the easier it is for more plaque to cling to it and continue the cycle. But the visible stain is only part of the story, because the most damaging changes may be happening under the gum line. This is why a mouth can look only mildly dirty while the tissues supporting a tooth are already becoming inflamed. And it is why simply scraping off what you can see does not tell you whether the mouth is truly healthy. The first stage is often gingivitis, red, swollen, sensitive gums caused by the body reacting to bacterial plaque. At this stage, the inflammation may still be reversible when the plaque and tartar are properly addressed and home care is maintained. If the process continues, inflammation can progress into periodontitis, damaging the ligament and bone that hold the teeth in place. That deeper damage is not just cosmetic. It can be painful, progressive, and eventually lead to loose or missing teeth. One of the earliest clues is often bad breath, especially when the odor is strong, persistent, or noticeably worsening. A dog's breath does not need to smell like mint, but a foul odor should not automatically be accepted as normal. Bad breath can have different causes, so it is a sign to investigate, not a diagnosis you should make at home. The gums may also look red, puffy, or unusually shiny, and they may bleed during chewing or when the mouth is examined. Some dogs begin chewing on only one side because the other side is uncomfortable, even when they still seem hungry. Others drop pieces of food, take longer to finish meals, or walk away from hard treats they once loved. You may notice pawing at the muzzle, rubbing the face, drooling more, or resisting when you try to touch the mouth. A quieter dog, reduced interest in play, or sudden irritability can also be connected to pain, although many conditions can cause those changes. Dogs are remarkably good at adapting, so they may continue eating even when their mouth hurts. That ability to cope can make dental disease easy to underestimate until the pain or damage has become advanced. The amount of visible tartar does not always match the amount of disease beneath the gums. A proper veterinary assessment begins with an awake oral examination, but that first look can only reveal part of the picture. To evaluate the hidden areas, a veterinary team may recommend a complete dental procedure under anesthesia, including probing and dental x-rays. Anesthesia allows the team to examine every tooth, clean below the gum line, protect the airway, and treat disease without causing fear or movement. Dental x-rays matter because much of each tooth lies below the gum, where the eye cannot see roots, bone loss, or hidden infection. A cleaning performed only on the visible surface may make teeth look brighter while leaving the disease-causing areas untouched. That is why cosmetic, anesthesia-free scaling should not be confused with a complete veterinary dental assessment and treatment. Trying to chip tartar off at home can injure the gums, scratch enamel, frighten the dog, or miss a painful condition underneath. Human toothpaste is also unsafe for dogs because ingredients and foaming agents are designed to be spat out, not swallowed. For prevention, daily brushing with a soft brush and dog-specific toothpaste is the most effective home habit for removing fresh plaque. The key word is fresh plaque. Brushing can remove the soft film, but it cannot safely erase thick, hardened calculus already attached to teeth. If the gums are already painful, forcing a toothbrush into the mouth can create fear and make future care much harder. When you see redness, bleeding, swelling, obvious discomfort, or heavy tartar, ask a veterinarian what should happen before brushing begins. For a dog with a comfortable mouth, start slowly by teaching that face and lip handling predict something pleasant. Let the dog taste a small amount of pet toothpaste, then reward calm behavior before introducing the brush. At first, brush only a few outer surfaces for a few seconds, then stop while the experience is still positive. Build the routine over days, not all at once, and never turn dental care into a wrestling match. Most plaque accumulates on the outer surfaces, so you do not need to force the mouth wide open to make brushing useful. Dental diets, chews, wipes, gels, and water additives may help some dogs, but their quality and evidence are not all the same. Choose products recommended for your dog by a veterinary professional, especially when your dog has allergies, medical conditions, or a painful mouth. Chews should match the dog's size and chewing style, and every chewing session should be supervised. Very hard objects such as antlers, bones, or hard nylon can fracture teeth, so harder is not automatically better. A dental chew may support home care, but it does not replace brushing, professional evaluation, or treatment of existing disease. Small and toy breed dogs often develop crowded teeth and may be especially vulnerable to periodontal problems. Their smaller jaws can place teeth close together, creating sheltered areas where plaque is difficult to remove. Dachshunds are not exempt, and their dental care should be treated as part of routine preventive health, not an optional beauty treatment. Age increases the chance that years of plaque accumulation have had time to cause damage, but young dogs can develop disease too. Genetics, tooth alignment, diet, chewing habits, saliva, and home care all influence how quickly problems appear. There is no single cleaning schedule that fits every dog, so the right interval should be based on an individual veterinary assessment. Some dogs need professional dental care more often because plaque returns quickly or previous disease has already damaged support around the teeth. Between appointments, check the mouth regularly when your dog is relaxed, using good light and a gentle touch. Look for new odor, yellow-brown deposits, red gums, bleeding, broken teeth, loose teeth, swelling, or changes in eating behavior. Do not force the mouth open if the dog is painful, frightened, growling, or trying to escape. Facial swelling, significant bleeding, inability to eat, a broken tooth, or sudden severe pain deserves prompt veterinary attention. A tooth that looks gray, purple, cracked, or unusually worn can also be damaged even when there is very little tartar. The goal is not to create a perfectly white smile. The goal is a comfortable mouth with healthy tissues and functional teeth. After professional treatment, home care matters because plaque begins returning long before tartar becomes easy to see. Think of brushing as maintenance after the mouth has been made healthy, not as a substitute for treating disease that is already present. Consistency beats intensity. A short, calm daily routine is usually more valuable than an occasional aggressive cleaning attempt. Reward cooperation, respect discomfort, and let your veterinarian adjust the plan as your dog's mouth and health change. Dental care may seem like a small detail, but it can protect comfort, appetite, play, and the simple joy of chewing without pain. So the next time you notice tartar, do not see only a stain. See a signal that deserves attention. Early action may mean simpler care, less pain, and a better chance of keeping healthy teeth for years. Start with one gentle look, one conversation with your veterinarian, and one safe habit your dog can learn to trust. Because tartar is not just dirt, and protecting your dog's mouth is one more way to protect the life you share.